I think that most doctors want to go into medical practice to make a difference, and many in their earlier careers see that as curing, where really there are so few things that there are things we can cure, we can make a big difference, but for a lot of people the important thing is to think about making sure that we're meeting their needs as well. And so I suppose the practical aspect of that for me is that I meet many people who their doctors are worrying about one thing and they're worrying about another thing. The challenge for all doctors is that you want your doctor to have a good, solid knowledge of medicine, and on the same hand you equally need to have good communication skills so you can understand the issues for the person and then try and help steer them through our health system. And the default step in our health system is to be active, to change things, and certainly if somebody has an acute heart attack and their heart stops, most people the right thing to do is to fix that. But there might come a time in somebody's life where that's not what they want, and so we need to think about how we negotiate those issues. And so for my practice I work with people who are all going to die, and so there's much more time spent on talking about what do you want, what is possible in the setting, and what are the important things for you. And so for doctors that's quite a big shift in sense of values and a philosophy of medical practice. It is for some. I think that our society is changing, but nonetheless I think generally death is something that most people don't want to talk about. You don't get into the car every day and think about the fact that you might crash it or you might die. It's not something even that people with cancer want to think about every day, but it is difficult for doctors because the default position is to be active, to try and change things, to make things better, and better is often interpreted in terms of cure rather than treating symptoms and caring. In our workshop we had a session on prognostication, and I think it really involves a complex conversation because invariably if you answer with a number or a time you are wrong because nobody has that knowledge. But nonetheless I think it's equally inappropriate to say, oh, I couldn't possibly say, or it's, put it in a religious construct and say it's in the hand of God or something like that, because doctors have spent years training and they certainly understand the natural history of diseases, but the challenge is to make a meaningful conversation for the person in front of them. And so part of answering that question is to find out why they want to know, and what else is happening in their lives. And is it that they're planning the overseas trip in 5 years? Is it that they have a son and daughter overseas who want to come and they are actually acknowledging that the end and there's a finite time? The really difficult conversation I get is when a relative will ring from overseas and say, I want to come and spend meaningful time with mum or dad, I want to be there when they die and stay for the funeral, and I've only got 2 weeks holiday. So I think that the right thing is to talk about why they want to know, but for certain diseases we can put a framework around that conversation. And certainly you can, for say cancer, when there is spread, when there are no more treatments that are going to actually modify the cancer, when we see changing physical function, that gives some framework to try and help give some answers to that question.